Today we're going to demonstrate a central line dressing change. There are several indications for changing out a central line dressing. The first is if it is visibly soiled, loose, or torn, where the integrity of the dressing is compromised. If there's a microbial patch, every 7 days, just plain gauze every 24 to 48 hours, or if there's plain tegaderm covering the site, every 5 to 7 days. For supplies, you'll need a central line dressing change-out kit, clean gloves and extra sterile gloves, hand sanitizer, and extra alcohol wipes if necessary, and a microbial patch, also referenced as a biopatch. You'll prep the patient with 2 identifications and explain the procedure. Make sure the patient has a mask on their face and you have one on yours, and assist the patient to a comfortable position and raise the tray table to a comfortable position for you to maintain sterile field. First, you're going to sanitize your hands and open your sterile supplies. You want to make sure that you place your supplies in a position that you're not going to compromise the integrity of the sterile field when you turn or move. Once your sterile supplies are open, so empty out the biopatch onto the field. Perform hand hygiene once again, and don clean gloves. The first thing to do is assess the integrity of the central line itself. Look for any type of erythema, swelling, or tenderness around the site. Once you've done that, you can remove the dressing, being sure to go perpendicular to the site, holding on to the edges, the catheter, and the biopatch to make sure you do not dislodge the catheter from the insertion site. This also helps with pain for the patient so that you're not tugging or pulling on the catheter. Once removed, you can discard the soiled dressing. Now you're going to assess the actual site. Make sure there's no drainage. If there is, you can take a culture and send it off for evaluation. You're going to want to remove the stat lock so that you're able to perform a cleaning underneath the area to ensure adequate removal of all contaminated areas. Remove your dirty gloves. Perform hand hygiene once again. And now you can don your sterile gloves. Again, being sure not to contaminate your sterile field. If you have difficulty placing your sterile gloves on, remember to apply the second hand's glove and then use your sterile gloves to adjust on each hand accordingly so that you do not contaminate your sterile gloves. Once your sterile gloves are in place, you can arrange the supplies for your dressing change. At this point, you can rid yourself of any supplies you're not going to need so that you can maintain integrity of the field. Opening the stat lock at this point ensures ease of application when appropriate. I like to remove the backing of my tegaderm so that it's ready to go when I'm needing it. The first step is to open the alcohol swabs and clean the area so that you can loosen and rid the area around the insertion site of any dried blood or debris that's been collected in the area. You want to start at the inside of the insertion site and work your way out 2 to 3 inches around the insertion. Next step is chlorhexidine. With the chlorhexidine, you want to perform the same routine going from the inside out in a back and forth manner. You want to make sure to clean around 2 to 3 inches. You also want to clean under the catheter and on top of the catheter as best you can, carefully to not dislodge it. You'll allow the site to dry. Once dried, you can apply the bio patch. The bio patch is applied with the blue top side up. The catheter is placed inside the slit and turned slightly so that it does not come out from the bio patch. This helps protect the skin from any type of bacteria getting into the insertion site. Once that is complete, you're going to apply the new stat lock and secure the catheter. At this point, you will take your tegaderm and you will place it over the new dressing and stat lock, making sure to get the insertion site in the center of the tegaderm, with the cutout of the tegaderm going over the lumens of the catheter. You can remove your sterile gloves and place on clean gloves at this point. You can remove the outer packaging of the tegaderm, being sure to keep the seal intact. Once removed, you're going to remove the white strips, place one underneath the catheter, securing the cutout of the tegaderm, and one across the top, securing the catheter to the tegaderm site. This causes a good seal at the opening of the tegaderm. Last, place the label with your initials, dating, and timing it. One last step is to make sure that you measure the insertion site to the end of the catheter so that when you are performing your charting, you can assure that this has not been dislodged or displaced at all. You're now done and can discard your trash.